Is natural immunity really better than vaccines? Do childhood shots cause autism or other serious side effects? And why do babies get so many vaccines so early? Hey everyone, and welcome back to the Three Koi Fishes channel. We are a team of parents with over 80 years of combined experience. We personally research and vet ideas, then use AI avatars to present our findings. To be clear, the underlying expertise and research are completely human. We strive to empower you with informative content to help your child thrive. Today's topic is one that weighs heavily on the minds of many new parents: childhood vaccines. It's a topic that comes with a lot of questions, sometimes conflicting information, and definitely some worry. But it's also one of the most important decisions you'll make for your child's health. I know, watching your little one get a shot isn't easy, and navigating all the information can feel like swimming upstream. But don't worry, you're not alone, and we're here to help. Today, I've dived deep into some of the most trusted sources out there, including the Mayo Clinic, Stanford Medicine Children's Health, and the Centers for Disease Control and Prevention, or CDC, to bring you clear, evidence-based answers to those tough questions. Our goal is to equip you with the facts so you can make informed and confident decisions for your family. Let's get started. All right, let's kick things off with a fundamental question that often comes up. Is natural immunity better than vaccination? It sounds appealing, right? Letting your child's body fight off an illness to gain natural protection. But let's look at what the experts say. According to the Mayo Clinic, the answer is a resounding no. While getting infected with a germ might provide a longer-lasting immune response in some cases, it comes at a significantly higher risk. Think about it. Preventing sickness by getting vaccinated is almost always better than getting an infection. Let's take a serious example. An infection from the Haemophilus influenza type B, or HIB, bacteria could potentially lead to permanent deafness, brain damage, or even death. Vaccines protect our kids from these incredibly serious diseases and their complications, vastly lowering the chance of spreading them. So, the pro here is clear. Vaccination offers safe protection without the dangerous risks of actual infection. Next up, perhaps the most talked about concern: do vaccines cause autism? This is a huge one, and it's completely understandable why parents would worry about it, given the amount of misinformation that has circulated. Both the Mayo Clinic and Stanford Medicine Children's Health are unequivocal on this. No, vaccines do not cause autism. Researchers worldwide have not found any connection between autism and childhood vaccines. The controversy you might have heard about stems from an original study published in 1998. But here's the crucial part: that study was thoroughly debunked, removed from the scientific record, or retracted in 2010. It was found to be based on fraudulent data and methodological flaws. Stanford Medicine Children's Health also highlights another rumor, that the preservative thimerosal, which was once in some vaccines, caused autism. But listen to this. Thimerosal was removed from all vaccines in Sweden in 1995, and autism rates still continued to increase there. The same pattern was observed in the US after thimerosal was largely removed from childhood vaccines. In 2004, after a thorough review, the Institute of Medicine rejected any relationship between vaccines and autism. So, the pro here is that extensive research has consistently disproven any link between vaccines and autism, providing peace of mind. Now, let's talk about side effects. Any medicine can have side effects, and vaccines are no exception. But are vaccine side effects dangerous? The Mayo Clinic explains that most vaccine side effects are not dangerous. Typically, they are minor: a low-grade fever, a headache, a little fussiness, or soreness at the injection site. These are signs that your child's immune system is building protection, which is exactly what we want. Rarely, a child might experience a severe side effect, like a serious allergic reaction or a seizure. These are rare, and healthcare providers are trained to monitor for them after vaccination. Of course, vaccines aren't given to children with known allergies to specific vaccine components. And if a life-threatening reaction occurs with one vaccine, further doses won't be given. The key takeaway from the Mayo Clinic is that the risk of a vaccine causing serious harm or death is very, very small. The benefits of getting vaccinated far outweigh these possible side effects for almost all children. This is a huge pro for vaccines. The vast majority of side effects are mild and temporary, while the protection offered is significant. This brings us to another common question: why are vaccines given so early in life? It seems like so many shots for such tiny bodies. The Mayo Clinic provides a very clear explanation. Most babies are born with developing immune systems. Vaccination ensures a baby has maximum protection from serious diseases and their complications as safely and as early as possible. This also helps prevent babies and young children from spreading illnesses to others, especially those who are more vulnerable, like infants too young to be vaccinated or children undergoing cancer treatment. Vaccine schedules are carefully timed. They're given when the protection inherited from the mother fades, when the child's own immune system is ready to respond, and, crucially, before kids are likely to come into contact with the germs that cause these real, dangerous infections. It's all about proactive protection. This early timing is a critical pro. It provides protection when children are most vulnerable, preventing severe illness and spread. Some parents wonder, is it okay to pick and choose which vaccines my child gets or to delay them? Maybe skip the ones for diseases that seem less common? Both the Mayo Clinic and Stanford Medicine Children's Health strongly advise against this. It's not a good idea to skip certain vaccines because that leaves your child unprotected and allows them to spread disease to others. Stanford Children's reminds us that diseases like polio and mumps might be rare here in the U.S. because vaccines are doing their job. But these diseases still thrive in other parts of the world. Travelers can and do bring these viruses back. Without the protection of vaccines, these diseases could easily spread here again. This is why widespread vaccination creates what's called herd immunity, protecting entire communities, especially those who can't be vaccinated. If you're worried about a specific vaccine, please talk openly with your child's healthcare provider. They're your primary source of reliable, personalized information. And if your child falls behind the standard schedule, don't panic. Your provider can help you catch up. So, the con of skipping or delaying is significant. It leaves your child vulnerable and compromises community protection, while the pro of following the schedule is comprehensive defense. Now, let's address another concern sometimes brought up. What is the link between vaccines and sudden infant death syndrome, or SIDS? Stanford Medicine Children's Health clarifies this, citing recommendations from the American Academy of Pediatrics, AAP. The AAP states that making sure your child is fully immunized can actually help reduce the risk for SIDS. Critically, no evidence has ever been found linking vaccines as a cause of SIDS. To make all of this even more compelling, let's look at the incredible impact of these routine childhood immunizations from an economic and public health perspective. I've got some fascinating data from the CDC for you. A recent CDC report, published in August 2024, analyzed the health and economic benefits of routine U.S. childhood immunizations for children born during a specific 30-year period, 1994 to 2023. And the numbers are absolutely staggering. Listen to these incredible pros. Among approximately 117 million children born during this period, routine childhood vaccinations are estimated to have prevented 508 million cases of illness. That's an average of 4 illnesses per child that were avoided. 32 million hospitalizations. That's almost 1 hospitalization prevented for every 3 children born. And an astonishing 1,129,000 premature deaths. Over 1 million lives saved. CDC also highlights the crucial role of programs like the Vaccines for Children, or VFC program. Established in 1994, the VFC program provides vaccines at no cost to eligible children whose families might not otherwise be able to afford them. This program ensures that access to these life-saving vaccines isn't limited by a family's income, promoting health equity for all children. It's a powerful testament to our commitment to public health. Now, as parents, you're the ultimate record keepers for your child. Stanford Medicine Children's Health reminds us that while your healthcare provider's office will keep track of vaccines, records can sometimes get lost if you change providers. So, it's vital that you keep a careful record of your child's shots. Think of it like a birth certificate. Keep it with your other essential documents. And what if your child misses a dose? Don't stress. For most vaccines, you don't have to start over. Your healthcare provider can simply resume the schedule. It's important to make up any missed immunizations to ensure full protection. Many states actually won't let your child start school without a complete vaccine record, so keeping up is important for their education too. To help things go smoothly, Stanford Medicine Children's Health offers these final tips. Discuss common side effects like swelling or fever with your healthcare provider, and ask when symptoms warrant an office call. Ask if your provider's office participates in an immunization registry, a great backup if your records get lost. Inquire about immunization reminder or recall systems that can alert you when vaccines are due or missed. And always bring your immunization record to all office visits. Make sure the provider signs and dates every shot. There you have it, parents. A deep dive into the facts surrounding childhood vaccines, drawing on the expertise of institutions like the Mayo Clinic, Stanford Medicine Children's Health, and the CDC. I truly hope this video has helped clarify some of your questions and anxieties, empowering you to make the best decisions for your little ones. Remember, your child's health provider is your best resource for personalized advice. Don't hesitate to talk to them about any specific concerns you have. If you found this video helpful, please give it a thumbs up and share it with other new parents who might benefit. We put a lot of effort into researching these topics for you, and your support means the world to us. Consider subscribing to the Three Koi Fishes channel to help promote it, and ensure you don't miss any of our future videos designed to help your child thrive. Thank you for watching, and we'll see you next time.